Hey, it's Dr. Jared. If you have a bulging disc in your lower back, there are 3 things that you must do to fix this problem. The majority of these don't even require surgery if you follow these 3 steps. Because your back is a series of vertebrae, a series of bones that are stacked one on top of each other. Between each level, you have a disc. That's this red part right here. Now, over time, with repetitive movements or with trauma, the inside part, the inner material of the disc, can actually bulge to the outside, that little bulge right there. The truth is, the majority of people actually have this bulging disc or this bulged disc condition. It only becomes painful or it only becomes a problem when it starts to butt up against the yellow part right here. That's your nerve. If that disc bulge butts up against that nerve or impinges or pinches on that nerve, that's when you start to experience pain. That's when you start to experience sciatic symptoms down your legs. So if we can show you the right stretches and the right movements to alleviate pressure on your disc, to pull some of that inner material back to the inside where it should be, all of a sudden you start to feel better and your symptoms resolve. So that's exactly what I want to share with you in this video. Again, these are 3 simple things that you can do to alleviate that disc bulge pain coming at you right now. Step number 1 is decompression. The reason these disc bulges happen is because of the pressure between the vertebrae. If we release that pressure, you'll see that that alleviates pressure on the disc and can help that bulge to relocate back to where it needs to be. I've got 3 methods that I like to show people for this. We've got a pull-up bar, we've got between 2 chairs, we've got a table. I encourage you to try all of these out and see which one works the best for you. I personally like the first one right here underneath a pull-up bar. We're going to grab and then just introduce a little bit of a bend in our knees until we are hanging from the pull-up bar. Now, the majority of my weight is supported by my hands, but you'll see that I still keep my toes in contact with the ground. And what you'll find with this is it's just a way to promote relaxation in your lower back. We want to cause those muscles to relax so that we can get the stretch in the vertebrae where we need to feel it. And so a way that we do that is it's just a subtle bend in the knees, keep the toes on the ground, and then hang there for as long as you can. About 15 to 30 seconds is ideal. It might be something that you work up to, and then I would repeat that 3 to 5 times. Method number 2 would be right here between 2 chairs. If you don't have the pull-up bar available, this is a great option. I've got 2 sturdy chairs. I'm just going to put my hands on them. I'm going to lock out my elbows and then do pretty much the same thing as the pull-up bar. Put my feet a little bit behind me, a little bit of a bend in my knees, but keep my toes down on the ground. Now with this, you're supporting the majority of your weight through your upper body through this downward pressure, but what you should feel is a negative pressure through your lower back, kind of this tractioning force through your lower back if you do it the right way. Again, you want to turn off your abs, turn off your lower back muscles, and just passively hang right there until you feel that stretch happening. Again, the same recommendations, about 15 to 30 seconds, and then repeat that 3 to 5 times is a good number to shoot for. Now, if both of those are hard, I know that that takes a lot of upper body strength to do both of those methods. This is one that anyone can do. It's completely passive. It's also fairly effective. What you would do is come up to your bed, and then we're going to put the pillow right here on the edge of the bed. That just makes things a little more comfortable. And then I'm going to lay my upper body down on the bed, but keep my hips off of the bed. Again, a subtle bend in the knees, but the toes are on the ground. And what we do here is the weight of my hips and my lower body is pulling down, but because my upper body is anchored here on the bed, it creates this nice stretching effect to your lower back. So you can create a traction force like this. And again, this one, no strength required on this. You can hang out here for even like 1 or 2 minutes and see how that feels. Just keep in mind that if you do that for that amount of time, get out of it nice and slow, kind of take it step by step. Use your hands, use your upper body to push out of it, because that is another very effective way at promoting this decompression in your lower back. All right, did you try one of those decompression techniques? Which one did you use and how did it make your back feel? I always love to hear from you. Leave me a comment down below. Now, step 2 is going to be a lateral shift correction. A lot of times with a disc bulge, patients will walk in leaning to one side. They often lean away from the side of pain because that helps it to feel better. However, what we actually need to do is correct that before we move any further, and so step 2 is going to help you to take care of that. If you have a lateral shift, I want you to follow this step. If you don't have this lateral lean, you might just jump straight to step 3. But this is what the lateral shift correction looks like. If I'm leaning over here to the right, typically that means the pain and the disc bulge is over here on the left. What we want to do is close that side down to relocate that disc back to the middle so that I can stand up straight. Here's how we're going to do it. Again, for this example, I'm going to lean over here to the right. What you're going to do is come up to a wall and then just lean whichever way you're leaning. You're going to put that shoulder against the wall. So if I'm leaning right, my right shoulder is up against the wall. Now for this, I like to get my arm out of the way, so I'm going to raise my hand up to about this angle right here just to move it out of the way. And then with my other hand, I'm going to put that on my hip and very slowly try to push my hips towards the wall. Go as far as you can, hold 2 or 3 seconds, and then come back out of it. And then we're going to push a little further a second time. Hold 2 or 3 seconds, and then come back out of it. And the goal is to gradually and incrementally work your way in to the wall, all the way in so that we're actually getting our hip right close to the wall, and then we're staying there for about 10 or so seconds, and then gradually come up out of it. You should notice that as you continue to do this with repetition, you get further and further towards the wall to the point where you can actually glide all the way over, hold it there with very minimal pain, and then when you come out of it, again, come out of it very slowly. You might use your arms and hands to kind of help you off of the wall. You should notice that that lateral shift has been, if not corrected, at least substantially improved. And so you want to continue to do that until we're standing up straight without pain. Step number 3 is going to be an extension series of stretches to your lower back. These are super effective at pushing that disc material back where it needs to be and alleviating pressure off of your nerves. Now, depending on how severe your bulge is, depending on how severe the pain is in your back, you may start with a pillow under your hips. And what we're going to do is simply lay down on our stomach in this position right here. If you can tolerate that, what we want to do is gradually get more and more into extension or bending our back backwards. So the first thing that we're going to do is remove the pillow. And again, what that does is that introduces a little bit more of a curve into our back. If that feels okay, I want you to get up to about 30 to 60 seconds laying on your spine. Try to stay relaxed. Nice deep breathing is going to be key to all of this. Now, if that's okay, what we can do is gradually start to introduce more extension by propping up onto our elbows. So now we're in this position right here. And what I would want you to do, what I would encourage you to do, is spend about 10 to 15 seconds up like this, and then come down for about 10 to 15 seconds. And then we're going to go up again, 10 to 15 seconds, and then back down. And you can repeat this about 10 times. Basically, it's getting into this extension and then coming back down out of it that helps that disc material to relocate. If elbows feels okay, we'd call this prone on elbows. What we're going to do is a half press up. So now I'm going to get my hands, I'm going to put them under my shoulders, and I'm going to just press as high as I can, as high as my pain and range of motion will allow. Hold that again about 10 or so seconds, and then come down for about 10 or so seconds. Just a little bit more aggressive as we get higher into extension. Remember to breathe, remember to try to stay relaxed as you work higher and higher. And then finally, the ultimate goal would be to get up into a full extension pose where your elbows are locked out and we've got a nice significant bend in our back. We're going to hold there for about 10 seconds and then come right back down for about 10 seconds. And then repeat this up to 10 times. Again, this whole extension series is going to be great at helping to redistribute pressure in that disc and helping to ultimately alleviate pain. So I hope that that's the benefit that you get. Now, with disc bulges, it's crucial that we not only perform the right exercises, as I've demonstrated in this video, but it's also crucial that you avoid the wrong movements that exacerbate your pain and delay healing. If you're curious to learn more about that, and I highly recommend that you do, here's a list of 5 things that you should not do or things that you should avoid if you have a disc bulge. Be sure to check this video out. Subscribe to Tone and Tighten by clicking this circle. I'd love to see you back for future videos. Hope this helps, and I hope to see you again soon.